Thanks, everyone. I'm excited to jump into our second video with our founders on going over the thesis for why we made each of the investments and hearing from the founders themselves about the thesis that they've developed to get to where they are today. I'm really excited today to have Shane, the founder CEO of Membio, and to share a little background on how we kind of came into the opportunity. And I'm going to pass over to Shane to kind of give his backstory to eventually launching Membio. But we had previously been investing in the alternative protein space and in the future of food. And it came down to thinking about what are the biggest market sizes of things that you could lab grow. And in first looking at the overall food space, we looked at every single muscle type that one could lab grow by species, from chicken, cow, pig, chicken, tuna, salmon, and ultimately made a separate investment in a company called Finless Foods, lab growing tuna, which is by market size the largest muscle that humans eat, which was bigger than chicken and cow, to my surprise. And then we said, well, that's an interesting thesis approach to the future of food, but what about other categories? Now that we know that cells of all different types can be lab grown at scale going forward, what are some of the other core verticals that we could look into which are commercializable? And so we decided to look at the body, and we said, well, if you took every part of the human body and you could lab grow it at scale, what is the biggest market size opportunity? And so we looked at skin, hair, bone, blood, organs, you name it. We did all the market sizing, and we ended up at blood, which is an interesting one, that blood itself was the largest market size of the human body. That one can commercialize. It was also the earliest from a low-hanging fruit. It was actually the easiest and most readily available to probably start lab growing by the gallon, at scale. And so we went off and we met with lots of companies in that overall space. We met with bone companies, organ companies, you name it, and ended up meeting up with Shane. And the initial thesis was the idea that we could lab grow blood by the gallon, initially being O negative, universally accepted blood, and really where we are kind of past the part of science where it's no longer a mystery of how we clone cells and can grow them grow them. The real challenge is now an engineering problem, and can we actually create new technology that can engineer the high volume production of certain cells? And so Shane went off and focused on Membio, first going after blood, and then seeing that there was certainly other expansions into tangential things from white blood cells, not just red blood cells. And so I'll pass it over to you, Shane, but would love to kind of hear your thesis of kind of, again, when you have lots of different things that you could start as a company, how you kind of narrowed in on this being the thesis initially from where you are now. We'll kind of go through the evolution of the thesis of Membio, but maybe share a little backstory on how that thesis initially developed.
Sure. Yeah. Well, first off, thanks for having me on, Skylar. Really excited to do this. And yeah, I mean, my personal thesis and the thesis of Membio, the first thing has always been, it's really critical to keep those aligned for me. And so for myself personally, I always knew that I wanted to create a net positive in the world. So adding more value than I'm taking away. And then it was a mental exercise of, okay, well, to do that, I should probably, businesses create value inherently, and that's their function in society. So I should do this through business. If I'm going to create a business, I should probably do something that I'm interested and good at, which for me was biology and technology. And then beyond that, it was fairly flexible. I mean, fitting into that personal thesis for me, it allows for the flexibility in that, it's not fixed on I must make X technology, Y size. It's saying, no, I want to create value. I want to use business as that tool to create value. And I want to enjoy myself along the way. So that was my personal thesis. And how that mapped on to Membio is somewhat interesting. So the generation of Membio starts very far away from blood or anything like that. It actually starts in an oil patch in Western Canada. where I was working on a project to install biofilters onto oil leases. And it really bothered me how large those biofilters were. And so I dug into, why does this have to be cubic meters in size to treat such a small quantity of methane off gas? And at the source of it was this mass transfer deficiency. So you can't grow methanotrophs or methane eating bacteria to high densities in liquid culture, for example, because there's a limitation on how much methane and oxygen you can get into water. And that was, at the time, my naive self said, oh, that seems like an easy problem to solve. I mean, it's so simple, just get more of that into this culture. And, almost 10 years later, here I am, and, finally have worked out the solution. But the genesis of that was, I knew that solving this problem had implications across the board, not just for remediation or the environment, but also the same problem in therapeutics, the same problem in a variety of different applications. But really, it was, it's based on this core philosophy of a cell. The behavior of a cell is determined by the environment that it's in. So by controlling that environment, you can better determine the outcome of a reactor, of a process. And so had this idea on how to make a better manufacturing technology by solving this underlying technical issue. The ultimate embodiment of that for me was red blood cells. I mean, this is the most consumed, if this is really the best at manufacturing, this is the ultimate application. Doing red blood cells at scale, replacing the donation system. I mean, on the value side of things, what that creates is such a net positive for healthcare systems across the world, and huge impact that can only be achieved by being the best or really good at manufacturing. And so that's the connection between that concept and how we ended on red blood cells. And that's how we got started, was, this is how we can add value.
I know for us, when we initially were evaluating market size opportunities, obviously as VCs and founders, our goal is to go after the largest possible market size that exists. In that once executed, you have the ability of growing into hopefully the highest future market size valuation. What's fascinating is that when you look at the market size for like bone versus hair and skin and blood and organs, blood was fascinating for a few reasons to us. One was just from the pure mathematical market size, the fact that I believe the numbers were roughly around 50 billion of kind of the blood market right now. If you kind of sell blood by the amount that you sell per milligram or by gallon that you ultimately get to, but you also have an industry where not only is it a lot of times founders are going after much smaller markets that are like less than 10 billion. Here you have something that's meaningfully above 10 billion, call it 50 billion plus. We also have an industry where initially looking at it, there's a shortage of blood on top of that, where if you could not have to get blood donated, if you didn't have to clean it up, identify what type of blood type it is, store it, if you could literally just make it on demand around the world. For us, that was the initial thesis that we really got attached to. And again, that it pales, it is significantly larger than the market size of like bone. When you look at the market size of how much you were to lab grow bone, still a great thing to do for the future of humanity. It's not nearly in high much of a demand as blood is, and is a lot straightforward in kind of the commercialization. When we looked at the future growth of lab growing organs as an example, we've probably met with now 15, 20 companies on the organ side. One of our companies we have that we're going to be doing a similar interview with is 3D Biocorp, which is lab growing organs, starting off with cartilage for the nose and ears. But we kind of said, well, what is the easiest, straightforward approach? And blood won hands down. As you kind of identified the red blood cell market, you as a company have also evolved in the overall thesis. So went from, while red blood cells are certainly a huge market, from a price parity perspective, It's also the one of the harder ones to hit because blood is donated basically freely. And so the great thing is the core technology of what you really built is a really impressive way of lab growing cells at scale, which could certainly be done for other things like white blood cells, which have much higher average revenue per unit. And so walk me through kind of the development of the thesis that you've had, because really comes down from founders, and investors is what can you do that ultimately is building the most value for the industry and for customers, and which is executable in the shortest time frame. So walk me through a little bit about how that evolution has happened overall for Membio.
Yeah, it's been a heck of a process for sure. I mean, we closed on our earlier fundraising round. We really had two objectives. One, who are we going to sell to? Who's our customer? And does the technology work? Show that the technology works. Those were our two objectives. And so the first one, who is our customer? We can't start off benchmarking against the donation system because we can't replace it. It's a very robust and honestly incredible system in how it's set up today and how it functions so well. So we asked ourselves, where can we sell a unit of blood for $10,000? Even at a $10,000 price point, we're still talking orders of magnitude more affordable than, let's say, the equivalent amount of cells for a T cell or an NK cell product. But that was our goal. Who's going to buy a unit of manufactured blood for $10,000 so we can prove out the concept and get into the market without having hundreds of millions of dollars to build out or financially validate our business model of the economies of scale were really important to get to the level of cost effectiveness that we were looking at. And so we spent almost probably the better part of a year looking at that, talking to customers, talking to blood banks, we explored sort of across the value chain of where blood is used and how it's used today, everywhere from therapeutics, diagnostics, transfusion, and really, said, okay, well, will somebody purchase this? Is there some high value application that's uniquely underserved where manufactured product would make sense? And for one reason or another, whether it was therapeutics, diagnostics, or transfusion, all of those came up as no. There wasn't a path forward there, and that was, honestly, it was a very difficult time because this is something that we had said to our investors, this is what we're going to do. And we're really keen on it and we see the value. And, we sold this whole vision of this is how we're changing the world. And we had to take a step back and say, okay, how else can we change the world? How can we leverage what we have, which at its core is a really great way of growing cells? How do we leverage that in a different way to create value? And that changed our thinking, asking that question and saying, okay, well, what does that look like? And through that process, obviously we did a similar process to you, started looking at other cell types and different application areas. And we were developing multiple technologies at that point. So cell lines for allogeneic cell lines, so universally compatible cell lines, and a bioreactor or hardware technology. We also had to make a decision on, it doesn't make sense to dual path these technologies. Which one has the strongest pull from the market? And we answer these questions again by going out and talking to people, by researching, by getting out there and really considering how to make that pivot. And is it still an interesting opportunity? Interesting enough that it can provide venture scale returns, it's fundable, something that our team is still excited about. There was a lot of questions in that transition that took many months to execute. It wasn't a, hey, we're dropping this and going somewhere else. it was well, that's not going to work. Let's go back to the drawing board, identify some other verticals or other ways forward, flush those out, narrow it down, land on the best one, and that's where we are. But it was
I think if
very
you think of like what you guys have developed at its core has really the core has never changed, which is that you have a really great technology that can scale the growth of cells to a level that's never been done before in human civilization, right? So go back to like the core thesis, like we now know in general science, we know how to clone cells.
yep.
But the challenge is can we make them in high volumes that they can be useful for therapies, whether it be blood, white blood cells, really any kind of cell type you almost want. But it is an engineering challenge really that you guys have solved. And so maybe share a little bit about what kind of does status quo look like today in the industry for effectively being able to grow volume of cells versus the magnitude of improvement now that you guys now have built from like your first model to what the future models are going to look like, because a lot of this is now more it's there's no science breakthroughs. This is more engineering, just like pedal to the metal and focus on solving this engineering challenge now that it's kind of the vision is in front of you of what you need to go forward to do, and now it's just time and money to kind of execute it. So walk through kind of status quo today versus that magnitude of improvement now of what the technology platform is that you built.
Yeah, absolutely. I think I need to provide one additional context for the scale at which we need to build our device now has also changed, because red blood cells are really in a realm of their own in terms of how many you need. I mean, 30,000 units at 2 trillion cells a unit every single day as an output in the US only is very, very different than a cell therapy 450 millions per dose, and you're not going to need that many in a year.
Great point. Yep,
So
exactly.
I think providing that context upfront is important. And now, instead of us developing this for our own purposes and our own, let's say, therapeutic development process, now we're fitting into a much broader consideration of other people's cell types, and it's a very different product per se to service this new market. The core technology is absolutely the same in that we have made growing cells extremely easy, particularly when you're going to do that scale up. But how that's applied is now modified to match the needs of our customers in this new vertical. And that's, I think, really critical that core technology staying the same. How we have to apply it now is different.
Yep.
So what the status quo is today, I think the best way to highlight this and how our technology is different is using an example. So there's so much diversity in biomanufacturing that even within the same cell type or the same product, every company is going to have their own flavor per se of how they're doing it, what their requirements are, how large they need to get, etc. But at some point in their development, they're going to need to go from making a small amount of cells to making a much larger amount of cells. That's the process that we de-risk with our technology. And so, for example, if you wanted to go from 1 liters to 10 liters using one of the existing technologies today, best case scenario, that's going to take you 6 months. Worst case scenario, that's going to take you 2 years, or you're not going to be able to do it. With our technology, we take that, we can do that scale up process in a matter of weeks. So imagine you've demonstrated proof of concept in a mouse model, and now you need to go to a non-human primate or a pig, and you need to scale up and generate that amount of material. Being able to do that transition in a week means that you can drastically accelerate your timeline to your next inflection point. That's just an example of how this really drastically impacts our customers. So instead of having to do all of that development and redesigning to finish your preclinical studies, now you can just motor along right through to your inflection point. And that's, I think at the core of it, it really is about aligning the most efficient manufacturing with the objectives of our customers. So now there's not a trade-off. they are the same. They're one and the same.
Yeah, I think when it's interesting, we think of the inside of our partner meetings and investment committees whenever we're evaluating deals. A consistent question we always bring up is around the magnitude of improvement, because as VCs and founders that are really going after transformational opportunities, you're not looking for just iterative improvements. You're looking for things that really bring you to a whole nother scale that you could have never done before. And that's going to help in this term, help with developing overall therapeutics, but also being able to actually produce the therapies at scale to deliver them. So you don't have to wait, months by the time they might be dead, by the time it's ever done. So being able to actually make them in large enough quantities and at scale, and also doing it locally. So I think you go back to the part about, from the use case now, I guess, and thinking about who the target customer is for what you've built, and the use case of how this will kind of be going forward used from a commercial perspective. What do you kind of envision now from a business model perspective with the customer? We went from initially going from a business that was going to be lab growing blood by the gallon, and selling directly to the market, to now being focusing on what the whole technology has been all along, a really impressive incubation technology to grow cells at scale. That means a modification of focus of what the go-to-market strategy is on the business model and who the customer is, and to walk through a little bit about kind of what that view now is about the core business model and kind of go-to-market strategy.
Yeah, I mean, the core business model, the easiest way to describe it is a razor blade model. So our reactors or our bioreactors are single use, which means they get used for one biomanufacturing run, and then they need to be replaced. We have a large controller that is a one-time sale. That consumable set is replaced every 2 to 4 weeks per controller, depending on what the cycle time is for a given customer. And so what this leads us to from a business model perspective is that we sell these controllers and we get a recurring revenue stream. The added sort of cherry on top for this particular market is, once a given therapeutic asset is based on our manufacturing technology, it is very unlikely that it will transition away to another technology. So the staying power of that recurring revenue is really significant. And when we think about the lifetime of a therapeutic asset being 25 years in market before it's off patent, plus development time, that's really reliable, really substantial revenue, particularly once it gets into market. And so we see this as being an extremely attractive, simple but extremely attractive business model for us. And there's certainly added benefits in terms of how it plays out for different customer segments. Our go-to-market strategy is to focus on preclinical assets, either through a CDMO or a therapeutic customer themselves. The reason why is for exactly what I said, that staying power, it works against us as well. So we're unlikely to have our technology be adopted at a phase 2 or pivotal trial stage, especially as an entry point. It makes a lot more sense for us to enter at the preclinical stage and then support that development throughout. And for our product specifically, our benchtop unit, which ranges in volume from 0.2 to 10 liters, can support everything from R&D all the way up to commercial scale manufacturing for any donor-derived cell therapy products. So one device, same device being used throughout that entire lifespan of that product in terms of its manufacturing needs. So we see that as a really compelling entry point and a really compelling business model.
That's incredible. I remember when we were discussing this too, what got me excited about that is you look for creating as much value for your customers as possible. And oftentimes that means being a platform. And you as a platform, I think you said it really well, the fact that the use cases of what a customer can use the incubation device for is a much broader spectrum than what it was before, from doing a smaller quantity all the way up through commercial scale to where you can do it to then sell therapies to patients. The fact that you have that one scale, it's allowing customers to now have new capabilities of how they're also generating revenue that they could have done before. And it's in a business model that I love the razor blade play. Again, when we think about our own investment decisions in companies, we're looking for companies that are usually not one-time revenue companies. We're looking for ones that have ideally high recurring revenue with high gross margins, but with also extreme stickiness. And what I loved about this is that the stickiness here is super strong. Once you're embedded, you become such an important component for what they're going to do for the next like decade plus. So again, really, you could hit on a lot of the core things that we look at when we're looking for our top investment opportunities. In the lessons learned too, maybe share a little bit about as you've kind of gone from the beginning of Membio to where you are today, that learning curve that goes through as you're talking to customers about what they really actually need, and how that kind of has helped direct overall the thesis of where the focus is in time and resources.
I think one of my main lessons is just really listening to what people are saying. And, the more that you talk to customers and a variety of different people, you'll pick up on the themes will be talked about and continue to talk about. And being willing to iterate on your own thinking and your own vision for what it is, I think is really important, in the sense of, I have an idea of what I had an idea of what our product might have looked like, but there's no way I could have imagined exactly what it is right now. That's come from our team in combination with talking to customers and all of this, and really being flexible in what that looks like, and being open to ideas and other approaches, and considering everything as the best path forward. I think that maybe a different way of saying that is not being so stubborn. There's times where that's really important, but there's also areas where that can be a hindrance, more of a shooting yourself in the foot.
I also think the willingness of founders to also there's certainly pivots that most companies go through. Where you end up is usually not where you're starting from of what the company is.
Yeah.
But I think the willingness of the founder to be able to navigate that with still holding on to oftentimes kind of a core thesis of the business, but knowing again where the focus is of commercialization. I think the evolution of going from red blood cells, which are a much lower price parity and harder to achieve, even though doable, to going after the things that can be for therapeutics and white blood cells, T cells. While on a total market size, it might be a more kind of more narrow core focus. It's much more commercializable in the short term. And as you go out to eventually growing the company more and more to M&A IPO, the market obviously will appreciate the fact that you still have these much bigger market opportunities like red blood cells that you can go after, but it's also something that requires more of a maturing overall of the technology to bring that price down, to be able to make that also part of the overall market that is addressable. And so it's an interesting evolution that one goes through in this overall process. In looking at, I guess, now the future, directionally, I guess, how do you see, just maybe taking a step back from Membio specifically, but in the overall just market right now, I guess, what are you seeing in general from a thesis about how this overall space is evolving of the future of lab growing everything, right? Obviously, core infrastructure platforms like you are going to play a critical role in we have the sticks and shovels of the industry. Like, you are the core infrastructure that people will be using to grow a variety of cell types. But any kind of interesting perspectives on, you have overall core theme of companies are able to do more with less, right? You have earlier, like pre-seed, seed companies are definitely able to do more with less capital. What you're enabling is what would have cost way more money and way more time to get to certain scales. Other companies are going to make significant advancements building on top of your infrastructure. And so just directionally, how do you see the future right now, and the future just lab growing stuff? Because it is such a huge, broad thing that was never capable before. The fact that you can do this in a relatively now, smaller environment, and not having to need a big giant facility to do something, really starts changing what humans are capable of doing going forward?
It's a very interesting question. I don't know if I've been asked that one before. I guess when you say that immediately, I immediately put a division in between therapeutics and non-therapeutics, because those are very different worlds in terms of what does the cell therapy landscape look like and why it looks that way versus the what does everything else look like in terms of that. So I can speak to both or either or if you have a preference.
Yeah, yeah, no, it's fascinating when when I think of where the world that you guys are existing in. Like we have one of our other portfolio companies, Integriculture, which is one that we're teeing up for kind of an introduction. With Integriculture, they're focusing on how to bring down the cost of growth factor to just make the cost of lab growing stuff in general cheaper. And so you're having a lot of these different hacks that are getting done from lots of angles, which in the end is producing a way of really being able to biohack more capital efficiently, both on the therapeutic side and to your point, the non-therapeutic side. Like even how we ended up with the thesis to invest in Membio in the first place started off with lab growing muscle to eat. And then it ended up being for for lab growing parts of the body to on a therapeutic side, and even to our lab grown organ company. So there's overall this thesis I think that's happening around that the cost of commercialization of lab growing a variety of cells is becoming less and less expensive to do, which is now opening up whole new opportunities. And so, do you see any kind of core directionality, I guess, in where that's going and what are kind of new things that are going to be, entrepreneurs call it 5 years from now, the things that they're going to be able to do that were not possible today?
I think generally speaking, the level of complexity of a resulting product can increase dramatically. What I mean by that is if it's really easy to get the inputs, you can focus your time on making that a really cool output, right? So I think about, I'll use an example. Let's say 3D printing tissues. Now, if you can have a really cheap and readily available supply of cells to feed into your printer, well, now you can do more experiments. Now you can increase the complexity. You can try, start dealing with that next layer of, okay, well, yeah, maybe we have a 2D tissue now. What happens when we go to 3D? What happens when we layer these together really effectively? And that's where I see it as it's moving up one rung on what our bodies do, right? So yes, we can grow one type of cell really well, right? And there's a lot of reasons why growing them individually is important. On the product side of things, combining those individual raw materials, let's say, into really complicated products, I think is what will happen moving forward. Yeah, I'm fascinated by it. That would be
I think
my.
you're bringing up a good point. I think that's 100% right. When we've looked at the space overall, right now the status seems to be really focusing on single cell type growth, and it seems to be the future is going to be more of this multicellular, which really is more of what an organ is, a more complex organ. And even when I think of our portfolio company 3D Biocorp, they're going after initially just cartilage, with the goal of eventually getting to livers, kidneys, and hearts. But you are talking about something that's a multi-cell type thing to do. And so I agree with that. That's a good point about where the future is going is from simplicity of cell type to more multi-cell type and more complications of how they work together. It will be really fascinating seeing at what founders and VCs are investing in this space 5 to 10 years from now, because effectively you're going to have most of the core categories over the next 5 to 10 years are basically going to be taken. Like you will have had most of them will have now, especially using your infrastructure to get there. We'll be able to say, okay, our new status quo is pretty much every cell type individually we can grow. Now, as we get to more complicated things, one of our companies in particular, actually with Integriculture, their longer term play is really kind of a building out what one would consider a future kind of artificial womb where you can kind of basically grow an entire entity inside of. And that itself is kind of like an incubator, which is what you guys have developed at scale. But obviously, it's a really interesting future, I think, ahead of us of where we're getting into. But it's going to require, obviously, a combination of efforts across companies and also building out the core infrastructure platforms that you're building to make that happen. I guess for last question, founders always appreciate hearing insights around, I guess, core wisdoms of like, if Shane could talk to the younger Shane, what would you have, talked to yourself? Kind of core things about how you figured out what opportunity to even focus on, because oftentimes there's so many things that one could do. How did you decide this was going to be the one to do it, and any kind of feedback along the way that has been kind of guiding truths for you as you've been growing Membio over the last few years?
Yeah, the thing that immediately comes to mind for me is just don't burn myself out. There is more. As much as I love what I do, and have a deep appreciation and am passionate about it, um, there has to be more outside of outside of the company. And I at some points I was working 100 plus hours a week for month-long periods, and the result of that was that the passion and the joy and my happiness suffered. So I think that that's what I would tell my productivity at the end of the day, realizing that, it really doesn't matter if I reply to that email at 11:30 at night. It's better for my mental health if I just rest and reply to it in the morning. So I think that, in contrast to what at least I heard a lot when starting the company of, oh, you have to work really hard. You have to be working on it all the time. There has to be a balance. And I think that that's one thing that I really needed to learn the hard way. And if somebody else cannot learn that the hard way, I think that would be great, because it was not fun to go through that burnout experience. And I mean, regardless of it, this is going to be a big part of your life. So do something that you care about and that is aligned with what you want to do with your life. And so I'll use myself as an example. I, at my core, want to create more value. I want to create value in the world as much as possible. I can do that in a variety of different ways, but I can also use that to get very passionate about what I'm doing. If my motivation was to become very rich, I don't know if I would be able to have the staying power, particularly through very difficult times like, hey, the thing you just spent a year looking into didn't work out the way you thought it was going to look out. Or, wow, you're really burned out right now. This sucks. It's because I was aligned and, what my value system or belief system is and what I'm doing on it, I'm passionate about what I'm doing, that I could stay through those. And so I would say that's a critical ingredient to success. So those would be my two big things.
Those are great. I know you mentioned kind of really impact and having that as a purposeful part of what you're doing. Even though we're not a traditional impact investor, we very much are focusing on impact. Really, that our belief is we can make the biggest impact on the world by going after the largest possible market opportunities. That also has the benefit of yielding potentially the largest possible future valuations of companies at the same time. So it's directionally aligned in impact and in financial returns. And we play a game internally every quarter where we see who can identify the opportunity that is the mathematical largest market size in multiplying the potential number of customers multiplied by the revenue model of that company. And so every quarter we do a little prize for who actually has identified that company. Might not be the one we end up investing in always, but it is a fun exercise because the magnitude of what a small, medium, large, and extra large and super massive market opportunity is, for companies that can be worth anywhere from a few $1,000,000 to all the way up through $1 trillion plus. It is a pretty broad spectrum. And so going after, again, from a core market sizing approach, was really exciting, kind of how we ended up really identifying the thesis around doing Membio in the first place, and how that market evolution has evolved. but the core of why we chose Membio has stayed to be the same. And so again, big fan of what you guys are doing, and really excited for the growth that you guys have coming up as well. So thank you so much, Shane, and I really appreciate you doing this interview on kind of the portfolio thesis of Membio. Thank you.
Thanks a lot, Skylar, for having me on. It's love talking about this. So it's been a pleasure. Thanks.